This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everyone, and thank you for joining us today for our HealthyU webinar series. Today's webinar is Feeling Dizzy, Treating Vertigo, Dizziness, and Other Balance-Related Issues. At any time during the presentation, please feel free to enter questions you may have in the Q&A feature at the bottom of your screen. We'll answer as many questions as we can within the time allotted when the presentation concludes. Your questions will remain anonymous to protect your privacy. Today's presenter is Kristen Krosick. She's a physical therapist and assistant director of outpatient rehabilitation at Mather Hospital. Kristen earned her doctorate in physical therapy from Stony Brook University and has been an outpatient therapist for 13 years. She has a certification in vestibular rehabilitation from the American Institute of Balance and has been treating patients with vertigo, dizziness, and balance disorders for over a decade. She is also an adjunct professor for Stony Brook University's graduate physical therapy program. Welcome, Kristen, and take it away.
Thank you very much. So again, my name is Kristen, and I want to just, I normally would get a show of hands, but I just want everyone out there to think about a time maybe when you were feeling dizzy or had a loss of balance, or know somebody who has experienced dizziness or vertigo, or maybe has had a history of falls. And today's topic is very important because it's important to educate people that there is treatment for those symptoms and conditions stemming from our vestibular system, which I'll get into a little bit more. And many people return to the activities and the things that they haven't been able to do, feeling comfortably with them or safely. So I want to start with how do we keep our balance? There are three systems, primary sensory systems that help us keep our balance. They are the visual system, which is input coming from what we see in the environment. Our somatosensory system, which is their receptors in our muscles, our ligaments, and our joint capsules that sense information from the surfaces that we either stand on or sit on. And then we have our vestibular system, which is our sensory system that's located in our inner ear, and that helps detect our position in the environment in relation to our body's movement or our head movements. So today I'm going to be focusing on the vestibular system and how it relates to balance and what kind of dysfunctions can occur in that system. Normally, in a healthy individual, these three systems work together to keep our balance. So you can advance the slide. Okay, so I just want to start, when there are issues in the vestibular system, people can experience a loss of balance, dizziness, and vertigo. And it's important to know that balance disorders can occur at any age, but are the #1 health complaint of patients over the age of 70. And approximately 90 million Americans, or 42% of the current population, will complain of dizziness at least once in their lifetime. So why is this important? Balance disorders and dizziness can increase our risk of falls. And each year, millions of people 65 and older fall. That's 1 out of 4 older people falling each year. And some estimates state that as many as half of all the cases are due to vestibular disorders. And less than half tell their doctor, so they go unreported. And then less than 10% of patients with balance and vestibular disorders are ever evaluated or treated by a specialist, meaning that they're not receiving the proper treatment and they're not getting better. So I found on VITA, which is the Vestibular Disorders Association information, that people with measured vestibular dysfunction, so someone with a vestibular or inner ear dysfunction who are also symptomatic, so they're experiencing symptoms, have nearly a 12-fold increase in the odds of falling compared with people who have neither of these risks. And people with a vestibular dysfunction who are asymptomatic, so they have the issue, but they're not even experiencing symptoms, also had a significantly increased odds of falling. So research shows that falling once will double your chances of falling again. And the prevalence rises with age, and there are about 2 to 3 times more incidences in women than in men. Okay, so what does this mean? So vestibular dysfunction can lead to falls, as I said. So if somebody is experiencing repeated falls, they're going to develop a fear of falling. And when someone has a fear of falling, there is a definite significant decline in activity. So when someone is more sedentary and not moving around, there is a decrease in balance and decrease in strength. And that is going to make it easier for a person to fall again, already compounding an issue of the fear of falling. So this is like a vicious cycle. And what we find in patients that we see in our clinic is that they stop doing the activities that they love to do, and they're showing signs of anxiety and depression. They're no longer going out with friends, visiting family, playing with their grandkids, doing the basic things like food shopping and cleaning, and doing more advanced activities like hiking and gardening. So as we know, balance disorders can occur at any age, but as we age, the risk of having a balance issue increases. There is a age-related decline in balance receptors, muscle strength and endurance, and our inner ear function. So I just want to touch upon the many things that can cause a balance disorder. So with people listening, you may be experiencing symptoms of dizziness or balance issues that may not be related to the inner ear. And I just wanted to highlight some of those because they need to be addressed as well. So medication can have side effects that cause dizziness and loss of balance, ear infection, a head or brain injury, musculoskeletal imbalances, lower extremity injuries, low blood pressure can lead to dizziness. And when you stand up too quickly, it could lead to a fall. And the impaired inner ear dysfunction, which is our vestibular system. I'm gonna go into that right now. Okay, so let's take a further look at the vestibular system. It's located in the inner ear, and I just provided a picture just so you can reference and see where the inner ear is located. So we have our outer ear, which the sound comes into, our middle ear, where it's transmitted, sound waves are transmitted to the inner ear. So the inner ear, you have one on each side of our head. There's a right and a left. The inner ear houses the vestibular organs. So this is the sensory system that's responsible for providing our brain with information about motion, head position, and spatial orientation. So what I mean by that is we have these organs that send information to our brain when we are moving, so acceleration when we're moving forward or backward, when we change gravity, so rising up from a chair, going up steps, when we bend down and stand back up, our head position, so looking up, down, right, left. All of these movements, there's information that the inner ear or the vestibular system sends messages to our brain to let us know where we are in space. So it's involved with motor functions that help us keep our balance, stabilize our head, and body during movement. It also gives us the ability to focus on objects while we're moving our heads. So what I mean by this is that we move our heads all day long, and the images that we see when we're moving our heads, they should be stable, they should be focused. And if there's an issue with the vestibular system, when we move our heads, the images that we see may be blurry, or they may be moving, and that is an issue with the vestibular system. Okay, so what are some symptoms of vestibular dysfunction? So dizziness is a big one. Vertigo, which is a spinning sensation, which I'll go into a little bit more. Falling or feeling as if you're going to fall. Staggering when you try to walk, which a lot of patients will explain that as, I feel like I just got off a boat, or I feel like I'm drunk. They complain of lightheadedness, faintness, or floating sensation, blurred vision or difficulty focusing, confusion or disorientation, and we call that a fog. So people will describe it as like, I just don't feel right, I feel like I'm in a fog, it's just not clear. Okay, so vertigo is one of the symptoms I want to speak a little bit more about. Vertigo is a term that's used a lot, and it's sometimes used inappropriately. So I just want to clear up what it actually is. So vertigo is a symptom, and it's not a condition. And the symptom is a sensation of whirling or loss of balance that could be caused by a disease affecting the inner ear or the vestibular nerve. So it is literally the sensation that you or the environment around you is moving or spinning. So it's like a whirling. And there are varying degrees of vertigo. It could be minimal or severe, finding it difficult to keep your balance and to do everyday tasks. These symptoms, this spinning can be a sudden onset, or it could be episodic for longer periods of time. So these symptoms can last seconds to several minutes, and it could go on for days and even months, and not days and months where it just does not stop the entire time. It could go on where you're getting the dizziness and it's relieving, and that could go on for a very, very long time. And I also wanted to just make the distinction between dizziness and vertigo. So dizziness is an altered sense of like a spatial orientation. It's a feeling where you just feel off, and moving around an environment with many things is just not comfortable, but it's not necessarily that spinning, whirling sensation like vertigo. So one of the most common causes of vertigo is a diagnosis I want to speak more about. It is called benign paroxysmal positional vertigo, and for short we call that BPPV. And this is a very long name, so I just want to go through each of these words so you know a little bit more of like what it actually means. So benign, meaning not harmful in effect, not malignant. Paroxysmal, meaning a sudden attack. Positional is a particular way something or someone is placed. And vertigo, as we know, is that whirling, spinning sensation. So this diagnosis affects 64 out of every 100,000 Americans. And it occurs during specific head movements. So while standing up, bending over, crossing the road, meaning, you would look side to side when you cross a road, or turning in bed. And it accounts for approximately 20 to 30% of diagnoses seen in specialized dizziness clinics. So how does this occur? So these brief episodes of the feeling of spinning are caused by these crystals that we have within our inner ear, and they're called otoconia. They're calcium carbonate crystals, and they lay on top of a membrane. And they work with these hair cells that we have in our inner ear. And they actually help to detect that motion I was speaking about before, where you are in space when you're moving around. So when they are in their place, everything is still and steady and there's no spinning. So what happens sometimes is that these crystals can come off of where they lay and they float within something called a semicircular canal. So we have 3 semicircular canals within our inner ear, and these little crystals can float within the fluid of these semicircular canals. And when they're floating, that's when the spinning and the whirling is occurring. And with anything that floats in water, what happens eventually is that they settle. And once they settle to the bottom, that spinning and whirling stops. So this can happen due to an injury. So that could be like an ear or head injury. It could be idiopathic, which is no rhyme or reason. You just woke up with it one day. And again, we have age-related decline of the inner ear. So these crystals can decay over time and they can weaken and break apart from one another. And then again, they float within the semicircular canals. So I just want to highlight some of the other symptoms of BPPV besides the vertigo. So when someone has that intense whirling sensation and that settles, the in-between, someone can feel a loss of balance still, they can become nauseous or even vomit, and then they complain of dizziness, just feeling off. So what can be done? So a person should seek medical attention or a trip to their doctor if they're experiencing any type of vertigo or other dizziness symptoms or even balance issues that are persistent or keep coming back. And by seeing your GP, you can get an exam. They may send you to a specialist like a neurologist or an ENT. So further testing can be done. So sometimes with these symptoms, they want to rule out anything that's not the inner ear or not a BPPV. So what they would do is do a brain scan or an MRI. And if they suspect something's going on in their inner ear, a test called VNG can be performed. And that is a diagnostic test to decipher maybe where this issue is coming from in the inner ear. And you may be sent for blood work, and also a referral to a physical therapist for vestibular rehabilitation. So what can be done in physical therapy for BPPV? What we do, because there are multiple semicircular canals and the crystals can get stuck in any one of them. There are more common canals that it may go to. So what we do is we'll perform an assessment test called the Dix-Hall-Pike. And once we determine if it's a left-sided issue, a right-sided issue, what canal it could be in, a trained physical therapist will perform a series of simple movements, such as we call it the Epley or the canal repositioning maneuver. And it helps to dislodge the otoconia from the semicircular canal and actually place it back where it needs to be. So in many cases, 1 to 3 sessions will work for BPPV treatment, and then people are on their way. Other people need the procedure several times to relieve their dizziness and their symptoms, and that's very, very treatable as well. So besides BPPV, I want to talk about our program here at Mather. We have a vestibular rehabilitation program. And I want to just walk through what that looks like and if you came into our program, what we can offer for any inner ear or vestibular dysfunction. So when we see a patient, they usually come in and they will complain of vertigo, dizziness, something we call oscillopsia, which is the visual issues. So it's difficult to focus on things. Unsteadiness, pulsion, which is you feel like you're being pulled in one direction, or you have that sense of falling. Visual vertigo, which is where textured backgrounds just really throw people off. Or balance disorders, someone who just feels off balance or even is experiencing falls. And a lot of times our patients, if they're experiencing these symptoms and have seen their doctor, they may come in on medications. So the more light to moderate cases, we may see an antivert or Dramamine that they're on just to kind of dull the senses and make the symptoms more tolerable. Or the more severe or acute cases, we sometimes see people taking some Valium or Ativan, but it's not always that people are on a medication. It's just that sometimes we do see this. Okay, so when you're evaluated by a physical therapist, we do a thorough history. And a lot of times with this history, we get a lot of information of where your symptoms are coming from. We will do a thorough questionnaire about present and prior level of function to see like what you were able to do and what you can't do anymore. We will review your past medical history, past surgical history, go over your medications, and any test results that may have been performed at this time. Then we'll do a strength and balance assessment just to see if those are all intact or where your deficits are. We do something called an ocular motor exam, and that is the connection between your vestibular system and your visual system, and we see if that's all in check. We'll do something called a CAT-SIB test, and I'll explain that a little bit more, but we do that on our biodex balance machine. And then, of course, if you're presenting with any signs or symptoms of BPPV, we will do that maneuver I spoke about to see if you test positive, and then we'll do a maneuver to correct that. So I just want to talk about this great machine that we actually have just added to our clinic, and it's a balance machine. It has a force plate and it has many programs. One of the assessments that we do is called the Clinical Test of Sensory Integration of Balance. So the three systems that I talked about earlier, somatosensory, visual, and vestibular, they're all supposed to be working a certain percentage to keep your balance. So there is a test that we can perform on this machine that will actually test how well each of those systems are working, comparing them to norms of someone, your gender, your age. And it actually helps us to assist with developing an appropriate treatment program, because it will let us know if your issues are more vestibular, if they're more inner ear, if they're coming more from the balance receptors in your feet, if you're having visual issues. So it's very helpful for us, and it quantifies your results. And therefore we could send this information to your doctor. We can send it to the insurance companies. It's a great system. And then from our evaluative findings, we come up with a treatment plan. So of course, if it's BPPV, I already went over what that would entail. And then we also have certain exercise approaches that we use. They're specific vestibular rehabilitation exercises to help reduce the following impairments: dizziness, postural instability, and gaze instability. So that would be the dizziness, like we spoke about, the feeling off balance, and then that visual issue that people may be having. They're unable to focus on things. And I added some pictures here just to show what some vestibular rehab exercises look like. And we also, if someone is presenting with a balance deficits, we also will provide a progressive balance training program. And the biodex machine that we have is a great machine for training as well. So that balance system has interactive programs that we train patients on, and it uses biofeedback. So there's lots of interactive games and stuff like that to help with balance. We will do a strength and conditioning program, and usually this is due to people who become more deconditioned and weak because they haven't really been moving around. They don't feel comfortable moving around, so they get into that more sedentary lifestyle and they become weaker, which really compounds the balance issue in itself. So we assess that and we will treat that. And then cervical treatment. I wanted to just touch upon this because when someone is feeling dizzy, when they have BPPV or they have any other inner ear disorder or dysfunction going on, what people tend to do is they stop moving their head. Like, if this makes me dizzy, I'm not going to move my head in that direction because I don't want to feel that feeling. So people start to walk around and they're very stiff in their necks, and they just move their body. They don't want to move their head. And what happens is the cervical spine becomes less mobile and tight, and the muscles become tight. So we provide some manual therapy techniques for that, and specific exercises for the cervical spine. And unfortunately, not every single inner ear disorder or vestibular disorder can be resolved completely. And there's many diagnoses of like why that may be the case. However, people who are experiencing a balance disorder or dizziness will need to find ways to cope with it. And a vestibular rehab therapist can help develop an individualized treatment plan for the vestibular or the balance issue to help that person feel the best that they can feel and get back to the most activity and function that they can get to. So the main goal with our program is to return to function. So we want everybody to be able to get back to the things that they need to do or they love to do. And then I came up with this list that I thought was a good way to ask yourself if you should seek further treatment, or if you know somebody who should seek further treatment. So when should I seek help if I think I have a balance disorder or a vestibular disorder? So you should ask yourself these questions. Do I feel unsteady? Do I feel as if the room is spinning around me, even for a brief time? Do I feel as if I'm moving when I know I'm sitting or standing still? Do I lose my balance and fall? Do I feel as if I'm falling? Do I feel lightheaded or as if I might faint? Do I have blurred vision? Do I ever feel disoriented, losing my sense of time or location? So if you answer yes to any of these questions, or know somebody that would answer yes to these questions, then we have this program here that you should maybe think about contacting us or coming to. So we provided some information, our direct number. You can call us to ask any questions that you want to ask to see if you would be appropriate for treatment in our vestibular rehabilitation program. A lot of times we will answer your questions, and then you'll go see your doctor or a specialist, and you would come in with a prescription for vestibular rehabilitation, and we would do our further assessments and develop your treatment plan.